Thank you all for joining us for this exciting session and opportunity. Thank you to our panelists for being here. This should be a fun conversation, interactive, so let's dive in. I want to start with Dr. Leslie Morse, Chair of Physical Medicine and Rehab at the University of Miami Health System. Dr. Morse, can you give us a sense of the overview on where the field is now and what you believe is coming in the not too distant future? As a clinician scientist, I also want to know what you're excited about.
Okay, thank you. So I would say that curing paralysis is one of the most challenging and difficult questions in medicine today. We have not, as a field, really unlocked the key to understanding how the central nervous system can repair itself. So by that I mean brain and spinal cord and the nerves that translate that information to the body. When we have damage to that system, it's very, very difficult to repair that. So that leaves us with, after a complete injury or even an incomplete injury, quite profound impairments in both sensation and strength, as well as impact on multiple organs within the body. So because we don't know how to teach or drive the central nervous system to repair itself, the emerging therapies that I'm really interested and excited about are about rewiring or teaching the nervous system how to develop new connections and new routes to get the information from the brain through the spinal cord out to the body and from the body back up through the spinal cord to the brain again. So neuromodulation is one of the key therapies that really allow and drive rewiring of this entire circuitry. I'm really excited to say at Lynn Rehab, so the Lynn Rehabilitation Center for the Miami Project to Cure Paralysis, we are a very unique collaboration between science and clinical care, particularly for rehabilitation medicine. And we are both doing research on some of the emerging technologies that I think really harness the power of neuromodulation, including spinal cord stimulation. And we've partnered with ONWARD, our industry partner, and our scientists at Lynn Rehab to do some of the work that has really demonstrated improvements in the paralyzed arm in terms of strength and sensation. We're doing work in brain-computer interface that allows an individual to control devices and environments with thoughts. So some really emerging technologies that would have been inconceivable a decade ago. We are trying to integrate AI to drive our therapies to be more responsive, more efficient, to learn and integrate data and information as rapidly as possible to give that information back to our therapies. And of course, robotics is a really important strategy to get people standing, walking, reaching for devices or reaching for things in our environment that would not be allowable with upper extremity impairment. So I'll stop there.
Definitely, and I'm so excited that we have sort of the entire ecosystem here on stage, right? So clinician, scientist, physical therapist, patient at the end, Alan, and Erika, you representing industry, so really want to get more into it. Melanie, as a physical therapist, how are you using these technologies in the clinical setting with your patients? How have you started to see therapies changing and the impacts on your patients?
So the technology's actually been really beneficial in allowing us to mobilize our patients sooner and get them up on their feet and starting to walk and try to really promote recovery as early as possible. I'm in the inpatient rehab setting, so we're starting it within the first week or two of their injury. So without that technology, it was very challenging for us. It would often take 4 people to be able to get people up and mobilized, and now with things like the exoskeleton, we have a Locomat, which is another robotic device that goes over a treadmill. We've been able to mobilize our patients much faster, so it's very exciting.
That's amazing. It's incredible. Shifting gears a bit, working with industry partners is incredibly important in developing this kind of technology. So Erika, can you talk about the relationship between you and industry, us as health systems, and then also the broader, patient community?
Yeah, absolutely. So I'm here representing ONWARD Medical, and ONWARD is a company with 3 different platforms that we're developing to help people with spinal cord injury, completely focused on spinal cord injury. So this last year, at the end of 2024, we had our first FDA approval for a device that Dr. Morse just referenced to help folks with upper extremity strength and sensation after spinal cord injury. So this is the first new device that's now available on market in the US in a very long time. And in order to take devices like this and our other two, we have a spinal cord stimulator to help, an implanted spinal cord stimulator to help with other autonomic changes that have to happen after spinal cord injury, and a brain-computer interface technology that's in the very early phases of research right now in Switzerland, where our company is based. So we have, as a industry partner, we create technologies. Without our clinician partners, without folks in the spinal cord injury community, without our regulatory partners, doesn't matter. Like we can't get anything out there and available for folks. So we work with our clinician partners to design trials to really understand safety and effectiveness of our devices. And we partnered on this first trial that generated the evidence that we needed to submit to the United States FDA to get our first clearance. University of Miami participated in this. University of Minnesota participated in this with Dr. Morse as a study PI, and working with the community to make sure the stuff we're asking them to do throughout the course of the clinical trial is actually reasonable and manageable for whatever period of time we're asking them to participate. So, and making sure that whatever we're developing is truly an unmet need in the space. So really, the work that we do, if done in a silo, is totally meaningless without the partnership that we have across the board with folks with spinal cord injury, with the clinicians who are prescribing these therapies, with the researchers who are making sure we're generating meaningful data to support our final regulatory submissions, and make sure then we find ways to make a sustainable business out of this. So working with different payers around this to really get this ecosystem going in spinal cord injury.
Awesome. I want to turn now to Alan, not only a spinal cord injury patient, but also an advocate who's done a lot of work for the Miami Project with the University of Miami. Alan, how do you view these discoveries and what it means to you and the broader community?
It's amazing to see everybody coming together, and not just coming together, but actually now seeing things come to market. I've been in a chair for 37 years, so to see stuff coming, it's priceless. And whatever you guys can do to get more involved, this is the time, this is the field. Sorry about the emotion there, but this is really coming. And I was one of the 65 patients in the ONWARD Uplift trial. I spent 4 months down at the University of Miami getting hand function back after 34 years. So not being able to do these little things. Living my life all the way through, knowing that things were coming, we've always heard about them. I've been watching the field. Some of my friends have implants from other studies that were done to see where ONWARD is right now with the brain interface. I know that when new injuries are coming, that there is hope, and there's technologies that are going to be, we can take them home and not have to go to a clinic. And for somebody like me to be able to know that after 37 years that the door is just opening and this is the time to get in, and for people to get involved, to see how we're all working together. The community wants this, community needs this. The littlest movements in our hands, sensation, like I said, that's priceless. And knowing that we're all working together as a team to bring it out there, it's time for this door to open and for us to kind of step through.
Couldn't agree more. Dr. Morse, you looked like you wanted to maybe say something more about that.
I mean, it's so inspiring and moving, and if you're not impacted by the need, the urgency to move this field forward by listening to Alan talk about this, I think you should talk more with him, because there is definitely an urgency. I think that we are all there's a mandate that we have to work together. We need all of the key stakeholders pulling together, sitting around the table, and putting everything that we have into solving this problem. So, teaching the nervous system how to cure itself, that's one problem, but restoring function through all of the amazing innovative technologies that we have at our disposal, that is critical, and we have to do that. We have to do better, and we have to get it into the hands and into the homes of our partners and our colleagues and our friends, because it means everything.
Definitely. Erika, tactically, how do you think that happens from the industry viewpoint? How do you think we take it from, research to therapy to the home use?
I think that's a great question. So we're at a really special point. I think Dr. Morse kind of alluded to this earlier. We know more today than we ever have before about how the nervous system functions, but we're still discovering things. Like, we just discovered a new neuron last year, we didn't even know existed in the human body. So we're continuing to have this really strong foundation of science that allows us to be able to create more precise therapies for individuals who need it, really individualized to different needs. And so for us to really understand an unmet need and to be able to develop a therapy and then get it out the door and make sure we're not pushing a rope when we're developing something, it's really time and labor intensive to get a new device out into the world. So we really have to make sure that as we go, we're kind of fine-tuning how we're thinking about getting it out into the market and making sure it's getting into the right hands, and it's really targeted and making sure that we're addressing the right unmet needs along the way. So it's really understanding what the problem is, making sure you're building something that's actually going to address it, and really work within the confounds of what we know and what we don't know today about the nervous system, and then making sure that we have the right folks involved in the ecosystem to get these devices out the door and approved to be available on market.
I think what you're highlighting is, and for the startups in the room, maybe that it isn't just in a vacuum, right? Making sure that you're developing something that can be commercialized and used, and that needs to be done in partnership. So thank you. Melanie, Alan, how do you see the future of AI and robotics being used not to just improve the physical components, but maybe the emotional well-being, those types of aspects as well of the patients?
Well, last summer, Medicare just approved getting personal exoskeletons up to $93,000, I think. So that's a huge step forward in creating accessibility to people out in the community. Traditionally, these devices have been used in the clinic and in rehab settings, and this would be a huge opportunity for people to get their hands on to some of these devices. And I think that that's probably our biggest challenge, is the accessibility out in the community of a lot of the technology. So that would be my hope as a clinician, of being able to move forward and have these devices available for people to use in their homes. So
Definitely.
I living it every day. I'm seeing where the technology is going, and the access, I'm going to go back to access, is getting us what we need to live a better quality of life. There's so many things out there, the chair that I am sitting in, the environment that I live in, being able to get around, cars, things that are going to allow people that don't have movement to move in different ways. And we see it now with AI and virtual reality, and like I said, I'm sitting in a chair that climbs stairs and does things that other chairs don't do. We should have that so we can live a quality of life that allows us to be more productive and not be a strain on the system, but be positive to the system and give back. A lot of people, unfortunately, living in a chair and living the way that things are, it doesn't allow us to go forward. And when you see these technologies that are coming out there, individuals should be able to shift over to the other side and be more productive in life and be able to live a better quality of life. And I think that's what's going to come to us. Is it coming quick enough? No. It's, I said, like, I've been sitting here 37 years to see what I just saw rolling in here. There are people that are out there that have technologies that are going to make our lives better. And working with these groups, that's going to make it happen quicker.
Definitely. So, Erika, what's next? What's next for ONWARD?
Yeah, so we're about to kick off our next big trial that is the next step for us to get this next therapy available on market. So we're really trying to fill the pipeline with different new therapies for folks with spinal cord injury. And so to do this, we'll kick this study up with 12 different U.S. sites, including University of Miami. Dr. Morse will again be involved in this. So we're really excited about our near-term progress, just to kind of keep this momentum going that we have right now. In the longer term, we are doing a lot of work to try to do things like restore movement, restore mobility, restore walking again. We've received quite a bit of press for our work in brain-computer interface technologies in the past, and right now it truly is research. We're learning a ton right now about how to restore walking after spinal cord injury. It's not ready to be a therapy yet, but we're every day learning more about what this looks like to actually bring this, to scale this up and to be able to study it at the scale that we need to study it at in order to really move this and bring this to the U.S. market. I think one of the big things that we continue to really understand is how passionate the spinal cord injury community is, and how, look, these guys, they need new therapies, they need better technologies. We have the technologies. We need to move as quickly as we possibly can to get these out the door, and just be painfully impatient about how quickly we need to get these things out. So the advocacy work that's going on to continue to make sure that at the end of the day, these things are sustainable and they are covered by insurance, because they are different and they are new and addressing unmet needs that have never been addressed before. So we're just really trying to build that ecosystem, and these are the things, like we see this flywheel forming as we as a community create this momentum in the space. It's really exciting.
Ellen?
And I think you have to understand, we talk about walking. I know that's the ultimate goal, but there's a lot that comes before that, during that. And I know things that are going on at the University of Miami with regard to bladder function. I know that you guys are working on that as well. So movement is one thing, but there are other things that within this technology world are going to help us, which is pain and other factors that you all don't see that we living in the paralysis world. So there's a lot of other things that happen there where technology and working together are going to allow that to happen as well. You might want to jump in on some of that.
Yes, I would say that one thing that is very much on my mind, particularly today and over the last several months, is how the landscape of academic research is changing rapidly. And so we as leaders in this field are going to have to be creative and innovative and flexible and adapt to a new funding environment, because the ways that we've done research in the past will not be present for us in the near future going forward. And we've talked about the urgency of getting these technologies from industry into the home. That requires academic settings to have the resources and the funding to move these technologies forward. And so as an academic leader, I'm thinking about ways that I can engage all of the partners and all of the potential avenues to keep our research portfolios robust and moving forward, to not slow down the pace of research, but to really accelerate it. it. I mean, we need it faster. We need more of it. We need it going on constantly, and we need a way to fund that, which means we need to partner with industry. We need to partner with our philanthropic partnerships, and we need to figure out how to use the resources that we have in all of our healthcare systems to really do the clinical research with the resources that we have. So we need to be creative, and in my mind, we need to start flexing and adapting today to stay ahead of what's happening.
Erika, do you want to expand on the regulatory piece? I think, Dr. Morse, what you mentioned is speed is the name of the game, I think, especially when it comes to AI, automation, any of this, but obviously there's a balance. So maybe you want to talk about some of the regulatory and challenges that you're facing there.
I mean, for me, I have a well-oiled machine with my current regulatory team, and it's very rare that I don't talk to them at least once a week about something we're doing. Like they're wonderful. The disruption recently has been a bit rocky for our review team to have some of them let go and then rehired a week later. That's not the stability we need from our partners right now. So I will say they've been incredibly responsive, incredibly understanding about what this field needs. There's a lot of people who actually are clinicians by training who really want to play a major role in this ecosystem by being the person to say, yes, I'm going to sign off on this technology and get it out there as quickly as possible, because they've seen it firsthand how much opportunity there is to help folks with spinal cord injury. And so I think we're really in a good place with our current teams in the neuromodulation space who understand the problem. They share a sense of urgency. They also share an interest in wanting to make sure that the therapies that are available are safe and effective. And so that's where they spend their time making sure that the risk-benefit tracks with what it needs to be for the kind of device you're trying to get through. So it's I would say it's working now, and I hope we continue to see that stability there.
Yep. Dr. Morse?
So the speed, we're not going to be successful by shortcutting the regulatory process. That's not the intention. The intention is to take one lab doing neuromodulation research and multiply that by 1,000, because it's not just 1,000 times the benefit. It's actually much, much greater, the advances that we can do. So we need more resources into the field, infused in the field immediately, and we need everybody working together, learning from one another, building off from one another, and advancing this. That's how, through good science, robust processes in a strong regulatory pathway.
I agree completely. Can I just add one thing to that?
Sure.
I would just say that, we as a company, when a technology or a certain kind of science is mature enough, that's when we get interested. That's when, like, okay, there's something here, we got to pull this forward. The early phase stuff is the foundation. Like the early learnings about what is working, what is not, the science to understand where do we stimulate, how do we know what's going on in the brain when you're doing these different things. Like as we move to a more democratized, decentralized type of healthcare system, we need to continue to make sure that the kinds of therapies we're putting forward are really anchored in science. And so I think that's where we play a certain role in this ecosystem, and we need this kind of the earlier phase stuff to also continue to feed the pipelines in order to be able to continue to move therapies out and get them available for folks with spinal cord injury.
Well, I want to say thank you. They're probably going to cue the Oscar music soon. So thank you to our panelists. Thank you to the audience. If you have any additional questions, please come find your panelists after the session. Thank you.